Hello. So today we'll be seeing the models of community psychology. So there are five models that we'll be seeing, out of which the first one is the mental health model of community psychology. So this model, it attempts to improve the mental health of a community. Okay, so by community here we mean that a group of people who are living within a particular geographical area. So here we want to improve the mental health of that particular community. So that is what we would focus on. So the mental health model is a response to the growing demands for mental health provision. Okay, so we have this, we are aware that the mental health needs of the community is not being met. So the provision of the mental health service is not adequate. So we have this realization. So that is where we work when it comes to the that is the assumption that we work in the mental health model. So the another primary assumption is that the earlier and larger the scale of intervention, the likelihood of reducing the incidence of mental health problems is greater. So we have to start the intervention as soon as possible in a larger way, the larger scale. So that is how we should be starting our intervention. So that is what we focus on in the mental health model. Okay, so here we assume that there is an availability of funding, okay, and a service delivery infrastructure. So unless we have this, funding and a proper service delivery infrastructure, we will not be able to address the needs of the community. Okay, so Edwards he explains that there are six intervention types in the mental health model. There are three types of prevention and three types of promotion. The first one is primary prevention. So here we are reducing the incidence of an illness. Okay, so we conduct a lot of safe sex campaigns, or we work on smoking cessation programs, so that we don't want them to get any sexually transmitted diseases, or we don't want them to get any lung related issues due to smoking. So we want to reduce the incidence of a particular illness. That is what we do in primary prevention. The second one is secondary prevention, where we want to reduce the prevalence and incidence of symptoms who are among the people who are at risk. Okay, so like there might be pregnant women who are, who are at the risk of drug abuse, or there might be teachers who are dealing with children who may be undergoing child abuse, or who are having learning disorders. So in that case, we are identifying the people who are at risk, and then we are going and giving the intervention to them. So we want to reduce the prevalence of the particular disorder among this high risk group, or we want to reduce the symptoms among this high risk group. So primary prevention is about reducing the incidence of the illness in the general population, whereas secondary prevention, it focuses on the persons who are at risk. Tertiary prevention is reducing the impact of illness on the individual's life. So these are the people who are already affected by a problem, but we want to reduce the impact. We want to prevent relapse. What is relapse? When you had a condition and that condition comes again. So you may have a relapse for drink alcoholism. You might have heard about this word in the context of cancer, where people, they have a second episode again. There can be a relapse. So just like that, we prevent, we reduce the impact of a particular illness, or we prevent relapse from happening. Okay, so it can be people who had a bipolar disorder or anything like that. So we don't want that to happen again for them. So that is what we do in tertiary prevention. So prevention, we saw primary, secondary, and tertiary prevention. Then among the six, the next three are promotions. So here again you have primary promotion, secondary promotion, and tertiary promotion. Primary promotion is a universal intervention. Okay, so we want to promote health, okay, among the whole population. So we want want people to run and walk for life. We want to give life skills in all the schools. We want to give health education programs. We want to do programs on menstrual hygiene or sexual hygiene. So we do all these programs on a universal level. On a greater population, we do this kind of promotional programs. Then you have secondary promotions, where these refer to interventions to improve human rights, to empower people, to work on health promotion. Okay, so here we include people who are institutionally disempowered. Okay, so here we do it for all the people, but we focus more on the institutionally disempowered. So we give training for the community health workers. So these people are more likely to fall sick. They have they have to contact so many people. So we give training for those people. We give interventions for them. So that's what we mean by secondary promotions. And then we have tertiary promotions, where these interventions are aimed at self-actualization. So we want these group of people to attain self-actualization. Okay, so there can be personal growth groups or encounter groups where we work on, their empowerment of those particular people. We work on their actualization. So these are the three types of promotions. So we saw three types of preventions: primary, secondary, and tertiary. Three types of promotions: primary, secondary, and tertiary. Okay. Then we have the we'll have a critic for all the models. So in the mental health model, if you see, in the rural areas, that is where there is a very high need for mental health professionals and this movement. But whereas there, you don't have many people who are going and doing things. Okay, so black psychologists, this is in the US context. So there can be a lot of barriers. So in India, if you see, they may, if we try to bring in this kind of a change in the tribal community, we may not have people who are able to go there and talk in their language and work on prevention and promotion for them. Okay, so they won't be able to access any of these services. Another inhibiting factor is that mental health professionals, they operate on the waiting mode, where we don't actually go and do something for the community. We just wait for them to come and approach us. Okay, you have a mood swing, then you come and meet me. You come to my office, you come to my clinic, and then you consult. You get a consultation. So that is how psychologists generally work in our country. So that is again a major critic for this mental health model. So not always do people come and say that I have this issue, I need I need intervention, or I need something, I need you to do something for this. So that is one of the main critics for the mental health model. And another is that mental health model has its roots in the mainstream medical discourse. So in this model, mental illness is a disease. So you can treat it, you can prevent it, but that is not always the case. Okay, and then it doesn't give much of an importance to social change. Okay, so these are the main criticisms that you can see for the mental health model. The second one is the ecological indigenous model. Okay, so this model focuses on interdependence. So what is the relationship that exists between the person and the environment? Okay, so here, we want to contextualize the practice of psychology. We want to find out what is the reality of community, so we want to understand psychology as how it is locally defined. So in each community, there is a different way in which we see things. Our approaches differ from community to community. So the main criticism that was there for the mental health model is that it is more westernized. But here, if you see, it is more to do with the culture or the context that we are dealing with. So we focus on that community, the context of that community, the culture that exists there, and then based on that we do our work. So here the main people who represent this model are the indigenous or traditional healers. Okay, so there are certain concepts which are important when it comes to this model. The first one is the communal psych. Okay, so it is not about the intra-psychic perspective or the individual perspective as of how we see in the mainstream models. Here we focus on the communal psych. How is the mindset of that particular community? Okay, so this tribe or this group, how is their collective communal psych? So we focus on that. And then we focus on communalism or collectivism. Okay, so how is their lifestyle? How is the interdependence that is existing within that particular community? Then we focus on humanism. Okay, so we understand the value of human being. Okay, so this is not much valued when it comes to the business community and all, but when it comes to this particular model, we focus on the concept of humanism. Then spirituality. Okay, so how are people connected? How is this individual and communal spirituality? Like, how is an individual an extension of the community, and how is the community a part of, having each individual as a part of it? So, spirituality is taken into account, and ecology. Okay, which is the unity of the universe. So, all these are important when it comes to this model of community psychology. So the indigenous ecological model is concerned with the contextualized world, which means you focus on the context of that particular community. Okay, so it is expressed in terms of succession. Okay, so how does change happen across each community? Okay, how is adaptation shaped by the environment? How do you recycle resources, including the community energy? So within that community, how do you recycle resources and make sure it reaches each individual? How do you work on interdependence of community levels and groups? So within that community itself, there can be different levels, there can be different groups. So how is the interdependence that is existing between those different groups? Okay, so that is what you focus on in the indigenous ecological model. Again, what is a critic? Okay, so this is basically a very contextually relevant model. So we focus on that particular community and the context that exists there. Okay, and we focus on the indigenous healers. Okay, so there would be indigenous healers that are present in each community, and we focus on them. Okay, so they would go and they would spread our ideas to the community. Okay, so that if it is a tribe and they have an indigenous healer there, so if that healer says that, okay, you have to do this, you have to take this vaccination, or you have to listen to what they say, then there is a higher chance that the people there would listen to or they would follow the instructions that are given by the community psychologist. So we make use of these traditional indigenous healers. They are equal practitioners of community psychology. Okay, and this is totally different from the usual approach that we have when it comes to mainstream psychology. Okay, so this might make some of the professionals feel that, okay, is this the right way to deal, or is this psychology is such a scientific field, how do you bring in this indigenous healers and all into this? So there can be this kind of a discomfort which you can see among the professional circles. Okay, and if you see, you can't generalize. So what works in one context or in one community may not work in another one. Okay, so you can't just transfer one model to another community without critically evaluating the similarities which are there between the two communities. So these are the critics when it comes to the second model. Okay, and then the third one is the organizational model of community psychology. So this model focuses on managing change in group processes. So how do you work on team building among the stakeholders in an organizational setting? So here we focus on organizational development. Okay, so here we want to see how we can apply psychological principles when it comes to an organization. How do we work on development in an organization using psychological principles? So OD theory is very much connected to psychology. Okay, so we transfer the applications of T groups and encounter groups into organizational settings. Okay, so we work on team building, we work on group processes. Okay, so when there was this very high regard on organizational development, or as a process of practice of organization development developed, there were a lot of social structures and systems which we found out were critical factors in organizational change. So we had this shift from individual to group effectiveness. So we had to focus on the group rather than on an individual. Okay, so Francis Cato was the person who described the multi-dimensional model of organizational change. Okay, so she has this is a model that is very much used in Italy. Okay, so she says that she has worked both in corporations and public institutions. So we take different dimensions when it comes to organizational effectiveness. So we take the strategic dimension, functional dimension, psychodynamic dimension, psycho-environmental dimension. So we approach the organization from different dimensions to see how we can make it more effective. So we recognize the multiplicity of organizations. Okay, so we also, take into consideration the local industries. So, in one community, there would be a local industry which has been there for quite a long time. People are very much emotionally connected to it. They would have had a lot of personal development and development of the family through that local industry. So those local industries are taken as active participants in the program so that there will be a mutual benefit to all the stakeholders. So we focus on the organizations for bringing a change in the community. Okay, so what are the challenges? One of the main challenges is the definition of community. Okay, so here in terms of OD, the client community is the team, the group, the division. So whoever is connected with the organization. Okay, so and another challenge which is there is some organizational systems may be neglected. So this system doesn't actually come under, community psychology. So we don't really want to focus on that. So we just ignore that. So that is again a challenge which we may face. Okay. And then organizational power. So here we are making use of the organizations to bring in a change in the community. Okay. So here the community psychologist may be hired by the organization. Okay, the management or the corporate might be hiring the community psychologist. So the community psychologist may have to listen to what the corporate wants. Okay, so the community psychologist may feel that, okay, this is the area that I have to work on. This is what has to be dealt with. This is having the highest priority here. But the corporate might be having something else in mind. Okay, they might be having a totally different agenda. So the community psychologists may have to work according to what the corporate wants them to do. So this is again another challenge which may arise when it comes to this kind of a model. Okay, because there is this power dynamics where the community psychologist is dependent on the management. Okay, so and I am hired by the management. At the same time, whatever the management tells me to do, I don't find it ethical. So there is always this tug of war within the mind of the community psychologist when it comes to working with an organization. Okay, then the fourth one is the social action model. Okay, so the social action model here, the mental health professionals, we generally say that uh, any mass disorder which is there or any disorder which is there among a bigger group, you can't eliminate that or bring that under control by treating the affected individuals. Okay, or by attempting to train individuals in large numbers. So it is not possible that way. Okay, so the social action model has its roots in the war on poverty. Okay, so there was this time when there was a broader social context where there was a civil rights movement. There was campaigning for black rights and protests against the Vietnam War. So all these things were going on. So the whole idea behind this model is that they feel that the mainstream psychology has failed to appreciate the link between behavior and social systems. So here we take the social systems into consideration. Okay, so here we see what are the structural inequalities which are present, and that is the reason for community distress. Okay, so just curing an individual is just like applying a bandage. Okay, so when you apply a band-aid, what do? You just cover it up. Okay, whereas there might be something which is there as an underlying factor, but you don't treat that, you just cover it up with a band-aid. So, curing an individual is just a band-aid approach. But where do we have to focus? Actually, we have to focus on removing the structural inequalities which are present, because that is the root cause for any problem that is there in the society or in the community. Okay, so we want to mobilize the communities. We have to put pressure on the institutions so that there are structural changes, so that there are no more structural inequalities. So if we take away the structural inequalities, that will improve the quality of the lives of the people. Okay. So they don't believe that individuals are responsible for poverty or ill health or poor education and all. Okay. So we were discussing Maslow's hierarchy. So in Maslow's hierarchy, you go from the bottom levels to the upper levels, right? So unless you work on the basic levels of basic needs of safety, physiological needs, safety needs, and all, then you can't move on to the higher levels. Okay. So here we say that we have to provide each and every individual with the basic needs that they have. We have to give them health care, we have to provide security, we have to give food. So that is the responsibility of a civic society. So you can't just say, okay, they don't have food, so that's how they are. Let the inequality be there. So that is not how the society should be functioning. Okay, so the reality in many societies is that more economically active minorities, they own the means of production, and they dictate the structural inequalities. So the people who are having all the money with them, they would be a minority. So if there are 100 people, all of the wealth would be with like 5 or 10 people there. Right. So they are the ones who are, having control over the production, what is being produced, how much is being produced, who should get it, who should have access to it. So all that is, within the control of this small minority that is financially strong. Okay. So here the whole idea behind this model is that you have to change the social structures. You have to get rid of this institutional inequity that is there in the first place. Okay, so that is where the change should happen. It's not about just giving mental health or just having this band-aid approach where you just find out, okay, these are the people who have issues, I'll just give some training to them. You have to work on the structural inequality, and then only you can reach the actual problem. So here you need to have a clear political commitment. You have to work on transforming the oppressive structures. Okay. So the community psychologist operates as an activist. So you're taking responsibility to organize, activate, mobilize, empower, conscientize, and give resources or make contacts which were not there. So that is the function of the community psychologist. Okay, so you bring people together, you remove the inequalities which are there, you activate them, you empower the people, you give resources to the people, you connect different people, you make them come into contact with each other. So that is the role of a community psychologist in this model. Okay, so community here is the political constituency. Okay, that is in conflict with the dominant institutions of the society. So here we want to, bring about a change in the material conditions of the community. So we want to see how we can bring about a change in the community. So what is the application of this model? So here, this is focusing on helping the disadvantaged people. So people who are facing the inequality in the society. So we are, providing psychological intervention for them so that they can manage their stress, they can resolve their, conflicts, they can mediate, they can, they can take care of the problems, and we can remove that structural inequality which is there in the society. Okay. So there are other interventions where we harmonize old and new forms of community psychology. So we, bring together the different systems which are already there in the community. So we may bring in an indigenous healing organization. We may bring in the modern healthcare system. So we bring all these together so that that inequalities don't exist anymore. So what is the critic? So the social action model, we want to, bring about a social change. Okay. So what are the main limitations which are there? The first problem is that social change can become limited to the constituencies it seeks to address. So when we want to bring about a social change, we will not work on the whole nation, or we may not work on a very big geographical area. So we may want to the social change is limited to the constituencies that we are addressing. Okay. And we want to identify the conditions of inequality, but we can't address that beyond a particular constituency level. So that is the main problem that we can face when it comes to the social action model. Okay. And we generally work on communities where there is social protest. Okay, and mostly this may not actually turn out to be very effective. Okay, so we may focus on one particular issue that is there, but that might be again part of an even larger system of structural inequity. So we may focus on one particular institution of the society, but that would be part of an even bigger structure. So we won't be able to touch on that area. Okay, and if there has to be a change, it has to happen at different levels: the macro level, social level, political level, economic integrations. All these levels have to be taken care of if we need to bring about a change in the society, because we are addressing structural inequalities here, which is there in the whole society. So we may have to work on multiple levels. Okay, so that is again a critic which is there. Okay, and then another critic is that there is a paradox in the model that assumes the capitalistic model is the dominant worldview. Okay, so we say that we acknowledge that there is a power and resource imbalance in the society, but we don't focus on what actually contributes to this inequality. Okay, so we don't allow communities to participate as co-creators of a more equitable society. So we don't allow the communities as such to participate. We intervene rather than making the communities to intervene in the society. Okay, and then the next model is the liberatory social community model of community psychology. So this model was proposed by Sereno Gache in 1987. So this person suggests that community psychology is a solution to the inadequacy of mainstream psychology. Okay, so that is kind of unsuccessful. So there is in this model there is an explicit commitment to social change. Okay, so it's not just about protesting. Okay, so we want to promote social change so that we can alter the oppressive situations which are there. So how do we do this? We generate knowledge, we carry out research, we develop intervention. So it is more liberatory in nature. Okay, so we bring in the social context as well as we view the whole thing as it is more liberatory in nature. Okay, so we want to find the solutions. It's not just about protesting or saying that, okay, this is what is happening, or this inequality is there is inequity, you have to intervene, you have to promote, you have to prevent. It's not just about that. It is, there is a clear cut commitment to social change. Okay, so each professional has a responsibility to find the solutions. Okay, and not merely protesting against that. Okay, so that is about the fifth model. So there are four stages. Okay, the first one is dissatisfaction with the Eurocentric, irrelevant mainstream psychology. Okay, so the mainstream psychology is Eurocentric, it is irrelevant. So first you need to understand that it's not enough to be content with whatever is told by mainstream psychology. There has to be some change. Okay, and we also the next stage is reactive critical engagement. Okay, so how do you engage with this? How do you critically deal with it? Okay, so you understand that you're not happy with it, you're dissatisfied with how mainstream psychology is, and then you critically think, you engage with the whole process, and then you define it yourself, you think about it, you think about what can be done about it, and then you work on discourse. What do you do about it? Okay, so what is the doing part of it? You are dissatisfied, you critically engage with the whole process, you constructively, you self-define whatever problems that you're dealing with, and then you work on it. So these are the four stages in the liberatory process. Okay, so this model has is theoretically you get the concepts from different frameworks. So there are two key elements to this approach. One is there is an acknowledgement of the historically changing social reality. So social reality keeps changing. It doesn't remain constant. Okay. The second one is that the model incorporates an analysis of human subjectivity and agency that is grounded in social constructivism. Okay. So you analyze the human subjectivity. What is what is the social political structure which is existing there? What are the ideological factors? So you have to incorporate all these things. Okay, so that is another way in which we can understand things. Okay, so you have to, understand the role of a social change agent. So the community psychologist is a social change agent. The person is a co-creator of social reality. Okay, so it operates at different levels of society. We have to understand the knowledge and skills to, understand the prevailing values in the society, to change the established structures, because we may have to, revamp how the whole thing works, how the whole structure of the community is. Okay, so we may have to operate at different levels. Okay, so we may understand things based on the popular culture. We may understand things based on how we can empower a particular society or a particular community. So we may have to spread some knowledge which is required for that kind of an empowerment. So all this happens when it comes to this model. Okay, so the strength of this model is how it understands social change. Okay, so it adopts kind of a Marxist perspective where each and every individual is seen to have the ability to construct and engage with social reality. Okay, it's not just about we reacting to it. Each and every one of us has the ability to engage with social reality. So that is how we see individuals in this model. Okay, and it is open to the influence of postmodernism. So we this model, if you see, it is kind of open. It doesn't stick on to one ideology. We keep it open to whatever change that is happening in the society. Okay, so how do you summarize whatever you have seen till now? So there are 5 models basically, and each of these models are direct responses to mainstream models of psychology. Okay, so the mental health model, it deals with the inadequacy of mainstream psychology, because you can't be in waiting mode and just wait for people to come. You have to meet the needs of a larger society. You have to provide community-based services. Okay, so the problem is that it just transfers the medical model to bigger population. That's it. There's nothing more to it. The indigenous model focuses on context. If you're working with a tribe, if you're working with a particular community, you focus on that particular community. Okay, so the indigenous forms of healing are recognized, and those people are taken into consideration. We make use of them to take the message to the larger society. Okay, and then the organizational models, we want to improve organizational effectiveness through organization development interventions. Okay, so we take the members of the organizations and the society there, we bring them together so that we can bring about a change there. So the main challenge is that there is a capitalistic value base. So the employees there may be still economically enslaved. We may say that we are trying to empower them, but they may be economically enslaved to that particular organization. The social action model seeks to empower communities. Okay, so we want to bring about a social change. We focus on social oppression. But again, a problem is that we may focus on one thing, but it may have a larger, context to it. So we may not be able to work on all the levels. Okay, and then the last one is a social action liberatory model, where human agency is considered as something that brings about a social change, and not just we co-create social reality. It's not just protesting, it's about bringing about that change. Each individual has the potential to bring about that change. Okay, so these are the 5 models of community psychology. Thank you.